with one of the first bills that I signed, reauthorizing the Children's Health Insurance Program, we fulfill one of the highest responsibilities that we have, to ensure the health and well-being of our nation's children.
Since 1997, the Children's Health Insurance Program has been helping low-income and disadvantaged children access medical services to treat or prevent conditions that can affect their ability to lead a healthy and productive life.
This is another attempt to grow the size of a government program to include more Americans into it without taking on the tough task of debating how in the hell do we fix health care in this country.
Economy when families are being forced to choose between paying their bills and putting food on their table, I cannot make it harder for them to keep their children healthy, safe, and cared for.
They don't accept federal government benefits. In other words, they're not at the taxpayer trough for at least 5 years. And what did we do? We discarded it. We said, no, we will let you at the taxpayer trough. We will let you there with the rest of the hogs on day one.
And importantly, 91% of all children covered under S-CHIP live in families with incomes at or below 200% of the federal poverty level.
For God's sakes, do not lecture me on what S-CHIP was designed to try to do in this country.
I cast this vote in the affirmative as a mother and as a former budget chairman for the state of North Carolina who knows how difficult it is for the state to close the gap in funding for this critical program when the federal government drops the ball.
In a decent society, there are certain obligations that are not subject to trade-offs or negotiations, and health care for our children is one of those obligations.